Well, did the CDC say that only 6% of COVID fatalities were directly caused by the virus? That's the claim going around on social media. And of course, our verified team checked it out. Here's Jason Puckett.
We've seen multiple versions of this claim. The core is the same. Quote, this week, the CDC quietly updated the COVID number to admit that only 6% of all deaths recorded actually died from COVID, then claiming that it's only about 9,000 deaths that were actually from COVID-19. To see if this is true, we checked with the CDC, CDC archives, and medical documents. To start, this report on the CDC website. It breaks down data from death reports and says, quote, for 6% of the deaths, COVID-19 was the only cause mentioned. That part's verified, but the rest of the claim doesn't add up. First, it says this is a new report this week. Internet archives show the CDC has been publishing this data for months. Here it is on May 9th. Same wording, same report, nearly 4 months ago. So the claim this is new information is false. So what about the other 94% of deaths? Are they not listed as COVID deaths? Well, the CDC calls these comorbidities, conditions or causes, quote, in addition to COVID-19. For example, fourth on the list of comorbidities is respiratory failure. The CDC lists respiratory failure as one of the critical, often fatal symptoms of COVID-19. So let's say COVID caused someone to have respiratory failure and die. Their death certificate would show respiratory failure and COVID. The easiest way to see this is by looking at a real death certificate example. Death certificates list a cause of death and other contributing conditions. So in 94% of the 183,000 COVID deaths, COVID was listed with other factors, but in 6% of them, COVID was the only listed cause of death. With your Verify, I'm Jason Puckett.